Hello, today I am discussing instruments which are usually asked in final MBBS exams. So today's class will be useful for the final MBBS students. This class I will discuss in 2 to 3 sections. In each class I will be discussing few instruments. So today I'll be talking on ambu bag, the mask and the Goodell's airway. Okay, first instrument is ambu bag. AMBU means artificial manual breathing unit. Sometimes this is also called bag valve mask. Ambu bag is a self-inflating manual resuscitator which is used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. And this is seen in hospitals, ambulances, emergency kit. It is always there, and this is a very important instrument which is usually asked in exams. So all of you have to know about this instrument. Okay, let's see the parts. I'll show you the parts. After that I'll discuss in detail. So here there is an inlet. Inlet has 2 openings. One is oxygen inlet, another is this is a air inlet. So this is connected to the reservoir or a corrugated tube. So reservoir bag is this one. So this type of bag is present. This is known as reservoir bag, which is connected to this area, and then here oxygen source is connected. And this one is known as the main self-inflating bag. And there are assembly of valves in this area. So here number 1 valve is the pop-off valve or pressure release valve, also known as the safety valve. And then another valve is known as fish mouth valve. So this yellow area you can see, this is it has a slit like opening. So fish mouth valve, and this is a one-way valve which allows air only to enter into the lungs and then prevents the exhaled air. So the exhaled air is coming out through this slit. There is a slit like opening around this yellow area here. So through this valve the exhaled air is coming out. And then this is the outlet or patient outlet, and then which can be connected to the mask or to the ET tube. So now I'll discuss everything in detail again. So air inlet, we had said air inlet, it has 2 openings. So one was, this is oxygen inlet. This is connected to the oxygen source, which can be cylinder or which can be central supply of your hospital. Another is, this is a air inlet. So air inlet, if you don't use a reservoir bag, then it is providing FiO2 of 40% to the patient. FiO2 means the concentration of oxygen patient is actually breathing in. Okay, so if you don't use the reservoir, patient is getting 40% oxygen, and if you use the reservoir, patient gets 90 to 100% oxygen. So if you want to increase the concentration of oxygen, then you have to attach a reservoir in this area. Then we said third part was self-inflating bag. So this one is known as self-inflating bag because after you squeeze this bag, it comes back automatically to its normal position. So this is known as self-inflating bag, and the material which is used to make this bag can be silicone or PVC. PVC is polyvinyl chloride. So if you use silicone material, that is reusable, but this is more expensive, whereas PVC material is plastic like transparent. It is more flexible, it is more cheaper and also easy to use. Now come to the volume ranges. So depending upon the different ages, ambu bag and this ambu bag and reservoir bag, it has different volumes. So newborn ambu bag capacity is 240 to 300 ml, reservoir bag is 200 to 250 ml. Infants, we use 240 to 500 ml capacity ambu bag, and for the reservoir 600 to 800 ml. Children till 8 years, 500 to 700 ml ambu bag capacity we use, and the reservoir bag should be around 1000 ml. And children above 8 years till adolescent, it is 1000 to 1600 ml ambu bag capacity. Reservoir bag capacity is around 2000 ml. And always remember, capacity of this reservoir bag should be 6 times the tidal volume of the patient. Now come to the assembly of valves. So here we talked about the pop-up valve or the safety valve, also known as pressure release valve. So here, if the pressure is too much, which can be due to your squeezing of the bag, or if there is some resistance in the lungs, then both ways the pressure can be high. So in that condition, this pop-up valve is getting released. It releases the air from here, air comes out from here and releases the pressure, so prevents the lung from barotrauma. And the maximum pressure is 30 to 35 centimeter of water you can give through the ambu bag. So if you give more than 30 to 35 centimeter of water, then there might be barotrauma to the lungs. And there is one way valve, that is this is the fish mouth valve. So fish mouth valve, this yellow one, is one way valve. So air and oxygen can go through this to the lungs, but it is preventing the retrograde flow of the oxygen. Expired air cannot come through this, so it is getting out through this slit. This slit around this area is the area through which the exhaled air is coming out, and there is an outlet here which can be attached to the endotracheal tube or the mask. Now come to the indications of ambu bag in the newborns. So during resuscitation, as per NRP Neonatal Resuscitation Program 8th edition, it has to be used if the heart rate of the newborn is less than 100 per minute after the initial steps. By initial steps you mean drying, stimulating, positioning and suctioning if needed. Then if there is apnea in the newborn, if there is a gasping respiration, then you use the ambu bag. Beside this, other conditions of respiratory failure like hyaline membrane disease, pneumonia, here also you have to use ambu bag. And there are some contraindications of the ambu bag, that is 1 meconium aspiration syndrome, 2 diaphragmatic hernia and 3 tracheoesophageal fistula. Meconium aspiration syndrome, if you bag, you will be pushing the meconium further down to the lungs, which causes obstruction of the airway and worsens the condition. Whereas in the diaphragmatic hernia, if you bag, then you are pushing the air through the gut, GI tract, then that means it is going to the maximum of the GI gut is in the lungs. So when the air is pushed through, then it will push the lung to the opposite side more, and then the condition will worsen. Same with the tracheoesophageal fistula, there are high chance of aspiration if you bag. So you have to be careful, and then it is contraindicated in these conditions. The indications to use ambu bag in the children is respiratory arrest or respiratory failure, and like in cases of pneumonia, asthma, bronchiolitis, poisoning, head injury. And whenever there is inadequate ventilation due to weak breathing due to the muscle weakness, like the conditions like GBS, that is Guillain-Barré syndrome, myasthenia gravis, any floppy infant, or even the bulbar type of poliomyelitis. And cardiac arrest as a part of PULSE, that is Pediatric Advanced Life Support Program. There also you have to use the ambu bag. And before intubation, to provide pre-oxygenation, you have to use this ambu bag in case of children. Now complications that are caused by the ambu bag can be in the respiratory system. It can cause barotrauma or volutrauma. So volutrauma is when there is too much of volume, like if the tidal volume is higher, then there is alveolar overdistension, and the example will be like overinflating a balloon. If you overinflate a balloon gradually, it bursts. Similarly, barotrauma is usually it is caused by the too much of pressure, like the different pressures you use. Example, PEEP, like the peak inspiratory pressure. So if those are too higher, then the alveolar is going to rupture. So example will be bursting of the balloon with the force. So those injuries can occur. So both conditions, there will be pneumothorax, pneumomediastinum, or subcutaneous emphysema. In the GI tract, there can be abdominal distension because of excess of air coming to the stomach. So when there is too much of air in the stomach, it impairs the lung expansion and worsens the condition. And there is also chances of aspiration and then leading to pneumonia. And in the cardiovascular system, when the intrathoracic pressure is high because of the overventilation, there is a decreased venous return and then cardiac output, and there is chances of hypotension. And if there is a problem or in the technique like mask leakage, valve malfunction or wrong bag size, then complications, there might be inadequate ventilations, and that might lead to complications like hypoxia. Now come to the second instrument, that was a face mask. So face mask also, it is usually made by soft PVC material, so it is very soft and it is transparent. So the benefit of this transparency is you can see the fogging coming with the breath of the child, and if there are any secretions also, that can be visualized. Now the types of mask can be cushioned rim and uncushioned rim. So mask with the cushioned rim is this one. So it has the advantage that it is comfortable and soft, and it makes a tight seal and then prevents the leakage of the air and also causes less injury, whereas the uncushioned rim mask will be not so tight sealed, and then there is chance of injury also. So usually the mask with the cushioned rim is used. Now come to the shape of the mask. The shape can be rounded like this, it can be anatomical like this, and then there is a connector here which is 15 millimeter or 20 millimeter, and this will fit into the ambu bag or ET tube. Indication of using the mask is during the positive pressure ventilation, and during nebulization you need to use mask, and then meter dose inhaler. In bronchial asthma, when you give a meter dose inhaler in a younger children, you have to use mask, and then you even many times you give oxygen supplementation with the mask. The masks are available in different sizes. So neonate preterm you should be using size 00. For the neonate term babies, size 0, infant size 1, and then pediatric age group size 2, and adults there is small, that is size 3, medium size, that is size 4, and adult, that is size 5. Now let's see the correct mask size and position, which is very important. So appropriate size will be if the mask is resting on the chin like this and then covering the mouth and nose like this. This is the correct appropriate size for this child. So over here you can see this is the correct one. This is incorrect because this is too big, so there is leakage of air, and this one is incorrect because the size is too small, so it is not covering the whole of the mouth and nose, so the ventilation will be inadequate in these conditions. Now come to checking of the self-inflating bag and mask, which is very important. So before using these instruments, you have to always check the mask and the bag. So to check the mask, you make a tight seal with the palm in the mask and squeeze. So normally when you're squeezing, the air is coming through this slit mouth valve and then going to the lungs. But if you're blocking this part, then the air will come out through the pop-up valve like this. So if this pop-up valve is getting lifted when you are tightly sealing the mask, that means the mask is normal, there is no leakage. And then for the bag, if you seal the mask tightly in your palm and then give a pressure on the pop-up valve and try to squeeze, it is not getting squeezed, so that means this bag is normally functioning. So this way you need to check the bag and mask before using. Now technique for bagging. So for bagging, mask should be covering mouth and nose, so that all of you know, and it should not cover the eyes. And then the technique to hold the mask is by E and C clamp technique. Okay, so to make this E and C clamp, hold mask with the thumb and index finger like this, the way they are holding. With the index finger and thumb, hold the mask forming a C-shaped clamp. So this is going to make airtight seal in this area. After that, middle finger is going to lift with the middle finger you lift the chin in the neutral or the sniff position, and then with the ring finger and little finger you press over the cricoid cartilage over here, forming a E-shaped. and this one is going to prevent the air through the GI tract. So you are preventing air going through the GI tract by making this clamp. So you should make this clamp and then only bag. So this is the way you hold the mask. After that you have to squeeze. Okay, so squeezing the bag, first squeeze is a rescue breath. So this squeeze you have to give a higher pressure, 30 to 40 centimeter of water. After that, subsequent squeezes will be at the rate of 20 to 25 centimeter of water. So squeeze whenever you bag, you should be in this position. The baby's head should be facing towards you like this, and you should be standing like this at the edge of the table. And look at this hand, this is a C-shaped clamp and this is a E-shaped clamp. So then you squeeze. So when you squeeze, you have to squeeze the bag very smoothly between the thumb and the fingers. So if you use one thumb and one finger, that will give you 15, the pressure will be 15 centimeter of water. So that is usually done for the 1 kg child. 2 kg child, you use thumb and 2 finger. So you're giving pressure of 20 centimeter of water. Then if you squeeze 3 kg child, you use thumb and 3 fingers. That will give you 25 centimeter of water. And then 4 kg child, you use thumb and all 4 fingers. So that will give you 30 centimeter of water. So usually you should not go beyond 25 centimeter of water. So 3 finger, thumb is the maximum amount to produce. Then produce a gentle chest movement. So when you to see whether your bagging is being effective or not, you have to look at this area. Okay, so this inflates the lungs, and this will be evidenced by a movement of the chest rise. You can see the chest getting elevated. So that means your mask and bag are correctly placed and you are doing the correct technique. Then the frequency of ventilation per minute, it should be 40 to 60 breaths per minute, and you should give a count loudly. So when you squeeze, it will be breathe, then you give a 2, 3, breathe. You have to do that way, 2, 3, breathe. So you have to give a time for the lung to expand. So when you start, you can start with the 21% oxygen in the term babies. In a preterm, we can use 21 to 30% of oxygen is used, and if required accordingly, you can increase the oxygen to reach your target saturation. So target saturation will be discussed later in the resuscitation class. Then the most important indicator of your successful positive pressure ventilation is rising of the heart rate. So you need to check the heart rate. Then improvement, another indicator will be oxygen saturation will improve, and another is equal and adequate breath sounds bilaterally, or while doing you can see the rising of the chest. There is another technique known as 2-person technique. So here one person holds the mask with both hands, the way you see in the picture like this, and the second person will squeeze the ambu bag. So this is usually recommended in the bigger children because the mask seal is harder to maintain by a single person. So one person holds the mask and another is doing the bagging or squeezing the ambu bag. Now complications or problems which can come. So one is mask leak. If it is there, then this will lead to inadequate ventilation. If it is too large, then there is an air leak and there might be eye compression. If it is too small, does not cover and mouth, this is also there is a inadequate ventilation. And sometimes because of the excessive pressure, you might lead to facial injury, especially if the mask is not a cushioned one, and there might be air leak with your pressure like pneumothorax, pneumomediastinum, and there might be gas in the stomach and abdomen leading to abdominal distension. The third instrument is Gödel's airway or oropharyngeal airway. It looks like this, and let's see the parts first. It is curved like this, and this curve is kink resistant and rigid, so that if it is rigid, it is not becoming straight and it pushes the tongue forward keeping the epiglottis of the posterior pharyngeal wall. Edge of this instrument is tapered like this, so that it is preventing the mucosal injury during insertion. And this area the patient's teeth is fitting, so reinforce bite block. So this will, and then this area is known as flange to limit the depth of the insertion, and in this area the fixation is done at the angle of the mouth. And then there is different color for different sizes. So this one is red colored, indicating different range of the size. So different size of the girdle's airway, there are 9 sizes with different colors. The colors indicate size. Okay, so 4 centimeter, 5, 6 centimeter, this way you get till 12 centimeter size. Now how it is fitting. So this tip end is getting inserted between the tongue and the posterior pharyngeal wall. So this prevents the fall back of the tongue on the posterior pharyngeal wall. So that means it is keeping the airway patent. So main function is to keep the airway patent, and this also prevents tongue bite during the seizure episodes. And then it will ease breathing if patient is closing the mouth. Also there is opening here, so the breathing will be comfortable. And you can even insert a suction tube through this and do the suctioning when the patient is keeping the mouth closed like this. So suction catheter can be introduced through this hole, and then suction can be done, and this patient is closing the mouth. So usually unconscious patients, this is done. Now technique to insert this tube. Introduce into the mouth with the concave side. This is the concave side, turning upwards towards the palate. Then after introducing, you are supposed to turn the tube 180 degree like this. Whole 180 degree you turn. So this concave part now is facing down towards the tongue, and it is touching the tongue, fixing in the tongue, and the posterior pharyngeal wall is there, tongue is there, and then mouth will be like this, biting this area, and this is the opening area. So fix airway with the adhesive tape around the mouth. The use of this tube is in status epilepticus. You have to use this in unconscious patient, and then micrognathia, that is receding of the chin, and then glossoptosis, that is falling back of the tongue. So in those conditions also you can use this tube. Okay, thank you. Hope this class was useful. Next class I'll talk on some other instruments.